Hello everyone. Today we will discuss about the high yield topic for FMGE exam which is upcoming in June 2026. Today we will discuss some of the very important pharmacology topic. These topics are equally important for INI-CET as well as for the NEET PG exam. If you are coming to my channel for the first time, then subscribe my channel for more such pharmacology related videos. Selective estrogen receptor modulators. This is also known as SERM, and these are the tamoxifen, raloxifene and clomifen. These drugs modulate the estrogen receptors differently in the different tissues. Now let us first discuss about the tamoxifen. So tamoxifen is having estrogen receptor antagonistic action in breast, and that is the reason it is used in estrogen receptor positive breast cancer. Tamoxifen is also having agonistic action in the bone and endometrium, and as it stimulates the endometrial tissue, it will result in endometrial hyperplasia, and that can result in increased risk of endometrial carcinoma. So tamoxifen can increase the risk of endometrial carcinoma. So this was about the tamoxifen. Now coming to the MCQ, a woman receiving treatment for breast carcinoma develops endometrial hyperplasia during follow-up. Which drug is responsible for this condition? The answer here will be tamoxifen. Fulvestrant is a selective estrogen receptor downregulator. Clomifen, raloxifene, these are also selective estrogen receptor modulators, but these does not increase the risk of endometrial carcinoma. So the answer here will be tamoxifen. Now another selective estrogen receptor modulator is raloxifene. Raloxifene is having estrogen antagonistic action in the breast and in the uterus, as well as it is having agonistic action on the bone. That is the reason it is used in postmenopausal osteoporosis in female. Now, raloxifene differs from tamoxifen that it does not increases the risk of endometrial hyperplasia, and so it does not causes increased risk of endometrial carcinoma. So, raloxifene does not increases the risk of endometrial carcinoma. This is very important concept, and that you have to remember. Now, coming to the clomifen, that is used for ovulation induction in the treatment of the infertility. Now coming to the MCQ, which of the following SERM is preferred in osteoporosis as it does not stimulate endometrium? And the answer here is a raloxifene. So here fulvestrant is selective estrogen receptor downregulator. Clomifen is used in ovulation induction in the infertility treatment. Tamoxifen can stimulate the endometrium and it can result in endometrial hyperplasia. So that is also not correct. So answer here is a raloxifene. Now coming to the selective estrogen receptor downregulator SERD, fulvestrant is a first generation drug, and here you can remember it as an estrant. ESTR that stands for estrogen and ANT that means antagonist. So these blocks the estrogen receptors and it also causes degradation of the estrogen receptor. So these drugs are used in estrogen receptor positive breast cancer, and this drug must be given by painful IM injection. So that is its biggest disadvantage. So these you have to remember. Now coming to the newer SERD, selective estrogen receptor downregulators. So the newer SERD include elacestrant, emcenestrant and camizestrant. These are oral SERD, so that is its biggest advantage. So this drug can be given by oral route and that is its advantage. Now coming to the MCQ, a postmenopausal woman with the hormone receptive metastatic breast cancer is started on a drug that causes degradation of the estrogen receptor. Which drug is most appropriate? The degradation of the estrogen receptor, it is caused by fulvestrant. So that is the answer. Tamoxifen, clomifen and raloxifene, these are the selective estrogen receptor modulator. So correct answer here is a fulvestrant, which causes degradation of the estrogen receptor, and it is a selective estrogen receptor downregulator. Fulvestrant, how you can remember that this drug are the downregulator, that means it causes degradation of the estrogen receptor. So remember, selective estrogen receptor modulator, they act differently on the different tissues, and selective estrogen receptor downregulators, they causes degradation of the estrogen receptor. So this is very important concept. So here you can easily remember that the downregulator causes degradation. So D stands for degradation. So this was about the selective estrogen receptor modulator and selective estrogen receptor downregulators. This is very important concept, and this type of the MCQs are commonly asked in FMGE, NEET PG as well as INI CET exam. If you like this video about the pharmacology, then follow for more such FMGE, INI CET and NEET PG related exam content. If you like this video, then subscribe my channel for more such exam related content. Thank you.